Complications of pregnancy. There are a number of common side effects of pregnancy. Not everyone experiences all of these, nor to the same degree. And although they are considered quote-unquote minor, this is not to say that these problems are not potentially very uncomfortable. These side effects include nausea, particularly during the first 3 to 4 months of pregnancy as a result of higher levels of estrogen in the system, heartburn, gas, hemorrhoids, backache, leg cramps, insomnia, constipation, shortness of breath, or varicose veins as a result of carrying a heavy load on the abdomen. These are minor issues. But there are also serious complications of pregnancy, which can pose health risks to mother and child, and that often require hospitalization. Hyperemesis gravidarum is characterized by severe nausea, vomiting, weight loss, and possibly dehydration. Signs and symptoms may also include vomiting many times a day and feeling faint. The exact causes of hyperemesis gravidarum are unknown. Risk factors include the first pregnancy, multiple pregnancies, obesity, prior or family history of hyperemesis gravidarum, trophoblastic disorder, and a history of eating disorders. Treatment includes drinking fluids and a bland diet. Medication, intravenous fluids, and hospitalization may be required. Hyperemesis gravidarum is estimated to affect 0.3 to 2% of pregnant women. Those affected have a low risk of miscarriage, but a higher risk of premature birth. Ectopic pregnancy occurs when the zygote becomes attached to the fallopian tube before reaching the uterus. About 1 in 50 pregnancies in the United States are ectopic pregnancies, and this number has been increasing because of the higher rates of pelvic inflammatory disease and chlamydia. Abnormal pain, vaginal bleeding, nausea, and fainting are symptoms of ectopic pregnancy. Spontaneous abortion is experienced in an estimated 20 to 40% of undiagnosed pregnancies, and in another 10% of diagnosed pregnancies. Usually, the body aborts due to chromosomal abnormalities, and this typically happens before the 12th week of pregnancy. Cramping and bleeding result, and normal periods return after several months. Some women are more likely to have repeated miscarriages due to chromosomal, amniotic, or hormonal problems, but miscarriage can also be a result of defective sperm. Preeclampsia, also known as toxemia, is characterized by a sharp rise in blood pressure, a leakage of protein into the urine as a result of kidney problems, and swelling of the hands, feet, and face during the 3rd trimester of pregnancy. Preeclampsia is the most common complication of pregnancy. When preeclampsia causes seizures, the condition is known as eclampsia, which is the second leading cause of maternal death in the United States. Preeclampsia is also a leading cause of fetal complications, which include low birth weight, premature birth, and stillbirth. Treatment is typically bed rest and sometimes medication. If this treatment is ineffective, labor may be induced. Maternal mortality. Approximately 1,000 women die in childbirth around the world each day. Rates are highest in sub-Saharan Africa and South Asia, although there has been a substantial decrease in these rates. The campaign to make childbirth safe for everyone has led to the development of clinics accessible to those living in more isolated areas and training more midwives to assist in childbirth.